Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 331. So what is good? The snow is finally melting in New Jersey, and I have to tell you, I was so over the snow. Many of you know that I am a Midwesterner, and so I'm from Ohio. I grew up with a lot of snow. So living here in New Jersey has been a bit of a break for me. I never considered Jersey to have real winters until, this year. This is maybe the second time that I've been, in a significant snow in New Jersey, and I've been here for almost 10 years now. But I am so ready for the last of the snow to finally go away, and it's just about there. So let's jump right into today's topic, IUDs, yay or nay? So I recently did a poll on my Instagram stories, and a whopping 67% of my followers gave IUDs a nay. I was, a little bit blown away. Because IUDs worldwide are the most popular form of contraception. In the US, IUDs are third behind female sterilization and birth control pills. So let's talk IUDs. IUD stands for intrauterine device. IUDs are T-shaped. They're a little larger than the size of a quarter, and once they're placed, they sit inside the uterine cavity. IUDs are 99% effective. IUDs are an example of LARCs, LARCS. That stands for long-acting reversible contraception. Categories of IUDs. We're going to keep this really simple. 2 categories of IUDs, hormone releasing and non-hormone releasing. Of the hormone releasing IUDs, there are a couple of different brands, Lolita, Kyleena, Mirena, and the non-hormone releasing IUD, there's only one. That's the Paragard. So depending on the type of IUD you have, an IUD can stay in place for anywhere from 3 to 10 years. So let's talk about the progesterone-releasing IUDs. Progesterone-releasing IUDs prevent pregnancy by thickening cervical mucus to prevent sperm from reaching and or fertilizing the egg, making the lining of the uterus unfavorable for implantation by way of causing the lining to thin out. Progesterone causes your uterine lining to thin out. It's that hormone released by the ovaries that actually causes you to have the period. Progesterone-releasing IUDs also prevent pregnancy by partially suppressing ovulation. Added benefits of progesterone-releasing IUDs are, number 1, they can be removed at any time and you will quickly return to fertility. Number 2, they can be used while breastfeeding. Outside of contraception, one of the biggest reasons that people use progesterone-releasing IUDs are that they can be used to treat heavy periods. In a nutshell, progesterone thins out the lining of your uterus. Hence, you don't bleed as much when you get your period. On the flip side, irregular bleeding or spotting can be an annoying consequence of progesterone-only types of contraception. So most of the brochures that you read will tell you that post-IUD placement, irregular bleeding can last anywhere from 3 to 6 months. In my clinical experience, I think it's closer to 6 to 8 weeks. So let's shift and talk about the copper IUD. Copper IUDs prevent pregnancy because the copper material creates a hostile environment for sperm, thus preventing sperm from finding its way to and fertilizing the egg. Copper IUDs are highly effective as emergency contraception. If they are placed within 5 days of unprotected sex, it is more than 99% effective in preventing pregnancy. This particular IUD can be associated with heavier, more painful periods. I'm going to say that again. The copper IUD can be associated with heavier, more painful periods. And I'm only mentioning that because it's one of the more common reasons that I see women discontinue use of this IUD. So common questions that I get about IUDs. Is an IUD right for me? Most women are candidates for IUDs. If you are in a mutually monogamous relationship and are at a low risk of contracting an STI, you are likely eligible. Back in the day, we used to say that you had to at least have had one pregnancy in order to get an IUD. That is no longer true. Again, most women are candidates for IUDs. Another common question I get about IUDs: do IUDs prevent STIs? No, like a resounding no. If you are not in a mutually monogamous relationship, it's important to use a condom. And this applies for other forms of contraception as well. Barrier contraception, like condoms, are what help prevent STIs. So how is an IUD put in? Pretty easy. Putting in an IUD, the actual mechanism is a lot like a pap smear. We bring you in, we put you in stirrups, a speculum is inserted into the vagina to allow for adequate visualization of the cervix. The cervix is cleansed with a solution, usually betadine, and then a single tooth tenaculum is typically placed at about the 12 o'clock position on the cervix. I usually distract my patients by having them cough, and just by doing that, most of them have no idea that I've even put this tenaculum on their cervix. The uterus is then sounded with a very thin sound. That's an instrument that lets us know the actual length of the uterus. And then whatever type of IUD you have is inserted. I usually like to insert IUDs when women are on the tail end of their period. However, that is not an absolute requirement. I like inserting when women are on the tail end of their periods because the cervix is, partially open, and I just find that it's sometimes easier. So after the IUD is placed, which usually takes just honestly minutes, the strings are cut, and then voila, you're done. So this next one is a really common question that I get. Is IUD placement really that bad? And I'm going to tell you it depends. I once read an article that was discussing pain associated with IUD insertion and doctors not really giving women a heads up, so to speak. If you're interested in that article, make sure you go to my website, askdrangela.com, askdrangela.com, and you can read the blog post that I did on IUDs, and you can click on the article so that you can read it. It's actually within the blog post. But in my experience, I feel like knowing is half the battle. It's important to explain the procedure to your patients and to women in general so that you know what to expect. I do typically recommend a non-steroidal 30 minutes prior to insertion. That can be anything from Aleve to ibuprofen to Advil. I find that this typically helps address cramping, which can be present during insertion. Post-insertion, I've had some patients become lightheaded, dizzy, a little crampy, but most people do fine. And, these symptoms aren't anything that maybe a cold compress, a glass of water, and some reassurance won't solve. The big thing is just making sure that the patient, i.e. you, are aware of what to expect before, during, and even after the procedure. So what do you think? Is the IUD for you? Do you give it a yay or a nay? I would love to hear your thoughts on this. Thank you so much for tuning in to this podcast. As usual, it's a pleasure. I always have so much fun doing this. Please make sure that you just check out my website, askdrangela.com. That's askdrangela.com. It's completely been revamped. There you can access all of my social media, whether it's Facebook, Twitter, or Instagram. You can sign up for my weekly blog posts, my YouTube channel, and the podcast, not just on iTunes, but on many other Android stations as well. iHeartRadio, Spotify, etc. So just go and you can just click and you can sign up on wherever you listen to podcasts. I'm going to leave you with this statement from another one of my favorite books, Life's Little Instruction Book. Lesson 257. Never ask a lawyer or accountant for business advice. They are trained to find problems, not solutions. This actually made me really laugh because I try to avoid talking to my attorney or my accountant as much as possible. Thank you so much for tuning in. Looking forward to reconvening for episode 332. Episode 332 of the Ask Dr. Angela podcast. See you later. Bye.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.